Hi, I'm Michelle Shoemate. I'm a professor at Northwestern University, and today's presentation is all about systems of care or integrative networks that are designed to promote coordinated service delivery across organizations. To begin this presentation, what I'd like to focus on is the help-seeking journey. What does an individual who has a need have to go through in order for them to receive a benefit or participate in a service or program? Well, that all starts really in step one, which is a client identifying that need and being willing to seek help. Once they're willing to put their hand up and say, yes, that's me, I would like some help, they have to then navigate a complex landscape of the variety of organizations out there. Perhaps spending time on Google or talking to friends, or maybe even calling someplace like the United Way 211 to identify an organization who might be able to provide that help. Once they've identified that organization, they need to go through an enrollment process. And that enrollment process might be relatively simple, or it might be more complex depending on the nature of the service. And finally, the individual will receive help. They'll cross the finish line. The challenge with the help-seeking journey is that we don't all start with the same level of resilience and willingness to engage in this process, particularly when we think about marginalized populations or those who have been historically oppressed. They're less likely to put their hand up to ask for help in the first place. There's a long history of institutional and systemic racism that has taught them that that's not a good idea. And in addition, there is among individuals who have needed help in the past, a kind of survival fatigue that just makes the whole process seem more difficult. Finally, some types of help seeking are stigmatized. And so putting up your hand might be a source of shame or guilt, depending on your cultural background. All of those factors mean that having a trusted human navigator who can come alongside you and encourage you to overcome some of those internalized barriers and some of those real external barriers can go a long way to helping reduce some of the disparities we see in the outcomes of health and human service networks. In addition, the challenges that individuals face in navigating this help-seeking process are exacerbated when it comes to step three. And that's because individuals who have poor documentation of their financial situation or their documentation status, or have a hard time figuring out where you would get certain paperwork because of either digital or other types of literacy challenges, can really put an additional barrier up in front of individuals who are eligible for and deserve to receive the help that they so desperately need. Coordinated care systems are designed to support individuals throughout this help-seeking process and hold promise to reducing some of the health and human service inequities that we see in terms of those systems' outcomes. Great systems of care also use something called closed-loop referrals. Closed-loop referrals track individuals throughout this help-seeking process and provide feedback to navigators so that they know when to intervene. So why are people interested right now in these coordinated systems of care? Well, there's at least a few reasons. One is the recognition that the social service and healthcare organizations operate in siloed methods of payment and operation systems. But coordinated care is needed across health and human service programs, and because we know that healthy outcomes are primarily driven by the social determinants of health. Things like employment and education account for 80 to 90% of healthy outcomes, where medical care only accounts for 10 to 20%. Second, we know that help seekers face numerous barriers to receiving those benefits, and these barriers are particularly acute for marginalized populations. And finally, many, and I would say most help seekers present with more than one need. They might, for example, be experiencing job loss, then require income support and employment assistance and housing assistance all at the same time. And this often leads them to seek help from multiple organizations and sometimes only receive partial care. This undermines the effectiveness of all of the organization's interventions because having employment assistance without affordable housing, for example, makes employment assistance less effective. So that's why coordinated systems of care, but what do they actually look like? Ultimately, these coordinated delivery systems have three components. The first one is, what's the referral platform that you're going to use? That's that technology system that is going to support the help-seeking process. The second design element is, what's the role of the human navigator going to be? Sometimes human navigators are call center operators or coordination centers members who are tracking and routing referrals. In other cases, human navigators are community health workers and social workers who are coming alongside individuals and are embedded in community-based organizations. Finally, different navigation systems are designed to support different stages in the help-seeking process. The most robust of these systems supports individuals from stage 1, where they're considering whether or not to seek care, to all the way through actually receiving services. But some have more limited designs. Finally, I want to tell you a little bit about 3 examples of coordinated systems of care that might provide some inspiration for you as you consider these perhaps new models of coordinated system service delivery for the first time. The first one of these is Healthy Alliance. It's run by Alliance for Better Health and its affiliates, and it connects underserved individuals to a growing network of organizations. They have over 580 organizations that span 22 counties in New York State. And the idea is to provide consistent access to resources that every New Yorker needs to be healthy. They used a closed loop referral platform, in this case, Unite Us, and they manage referrals within their coordination system to ensure that community members get connected to needed services. One of my favorite things actually about this particular group is that they also use that referral platform as a diagnostic tool to identify social service and health organizations who could use additional technical support in order to be able to close the loop on more referrals or provide services more quickly. The second group I want to point out is actually a group that comes from the south side of Chicago, Southwest Systems of Care. This is a somewhat unique group in that it is a community-based and run system of care for one particular set of neighborhoods in a larger metro area. The network does incorporate traditional nonprofits, government agencies, and community-based organizations, in addition to health providers. In terms of referral platform, they use the IRIS case management system to connect and communicate with local providers and facilitate the healthcare organization. But they use human navigators to assist and support community navigators in the care-seeking process. The human navigators operate inside of community schools, and the schools provide the access point for students and families to enter the care system. And they share information about available services and communicate with providers on behalf of these community members. The 2 things that I appreciate most about Southwest Systems of Care are, first, the human navigators that we've had a chance to interact with are really celebrate every time that a family that they have worked with gets all the way through the referral process. They kind of look at the tracking system not as a system that just supports the tracking of referrals itself, but also provides an opportunity to celebrate every time that the system is able to report that somebody's gone through that entire help-seeking process. The second thing that I really like about this is that they have identified that many people, when they were looking for care, weren't accessing community-based organizations that were local to the southwest side of Chicago. Instead, what they were doing was they were Googling and ending up running all over the Chicago metro area trying to receive services. And so by providing referrals to local community-based organizations, they fulfilled one of the goals of the system, which is to empower the local community to meet its own needs. The last of these different systems that I wanted to introduce you to is NC Care 360. NC Care 360 is the statewide coordinated service system in North Carolina. And it's collaboration between United Way of North Carolina, Unitas, the Expound Decision System and Benefits Data Trust, and the North Carolina Resource Platform. They have a resource directory, data repository, and shared referral platform. They're using the Unitas platform in this case to enable to refer clients to one another. Clients can refer directly to one another, and they use a no wrong door model, meaning that there's no right way to enter the network. Any provider is potentially the right place to get any of the resources that you need. And so they refer directly to one another. The thing that's probably most noteworthy about this particular systems of care is the state has become almost a model for other states across the United States, in that they've been able to redirect Medicaid dollars to human service providers because they are addressing effectively the social determinants of health. If you're interested in reading more and learning more about these systems of care, I've got 3 resources on the slide that I think might be helpful to you. One is a report on the Social Determinants of Health 101 for Healthcare that was put out in 2017 by the National Academy of Medicine. The second is an article by Caroline Fitchberg and her colleagues in Health Affairs that talk about these health and human service integration. And the last one is a report that I authored, really mapping out the different types of navigation systems in Pennsylvania and providing some local context there to the different ways that these networks are designed. I hope that this presentation has been helpful as you've begun to learn a little more about systems of care. And if there are other ways that I can support you, please reach out to me. I can be reached at shoemate@northwestern.edu, or you can find me on Twitter at Prof. Shoemate, SHUMATE. I'd be happy to engage with you there.